Stenosis simply refers to a narrowing of a hole. And there's two holes, one on each side and one through the middle. And so stenosis is either going to be caused, it's a narrowing of that hole. It's going to happen one of two ways. Either there's some soft tissues, such as a disc bulge, that is causing the stenosis. The degenerative change, the hard tissue changes, those will have been there for years. And they are often there years before you've had the pain. It's important to bear that in mind. It is mostly the soft tissues that are responsible for your current levels of pain, discomfort, or disability. And so working with the program helps you strengthen up the area, the protection for the area, so that the area that is injured in the lower back, let's take the L5S1 example. As we're working through our spine stability-based exercises, we are providing more protection for this area so that you aggravate it less frequently, so that it can go through the healing process it is trying desperately every single day to do with greater levels of success. As you progress the rehab work, you are strengthening up the muscles around this area, which help create more protection, so you are capable of doing more during the day without aggravation. And then long term, as we apply load through our spinal rehabilitative exercises, these are particularly things like the squat and hip hinge, you are applying load to the spine, which is helping guide the healing and strengthening process in this disc so that it becomes objectively more capable of bearing load, stronger and healthier in that regard, or at least more functional, more supportive in that regard, more capable of bearing load. Alongside that, you do relief-based practices such as the contrast bathing, such as the towel decompression and bed decompression. Now, the contrast bathing in particular is quite an aggressive way, and I don't mean aggressive in a bad way, but an intensive way, let's say, of helping manage the excess inflammation in these little holes where the nerves come out. And that is something particularly for those that have more significant levels of stenosis or degenerative change in the spine leading to more degenerative type stenosis. Those individuals will find that contrast bathing is quite a helpful one to use. It really does help quite a bit. But you have to do it consistently, and it's much better than just dosing up on painkillers that have all sorts of side effects.